ADHD is a chronic condition that impacts an individual's emotions, behaviors, and the ability to learn new things. It mainly affects children but can also occur in adults. The effect of ADHD can vary from person to person. To be diagnosed with ADHD, symptoms must have an impact on your day-to-day life. ADHD is divided into three main types: inattentive type, hyperactive impulsive type, combination type. Everyone is different, so it's common for two people to experience the same symptoms in different ways. For example, these behaviors are often different in boys and girls. Boys may be seen as more hyperactive and girls may be quietly inattentive. The symptoms you experience will determine which type of ADHD you have. More girls are diagnosed with inattentive type of ADHD than boys. Children with hyperactive impulsive type ADHD can be a disruption in the classroom. They can make learning more difficult for themselves and other students. More boys are diagnosed with the hyperactive impulsive type than girls. If you have the combination type, it means that your symptoms don't exclusively fall within the inattention or hyperactive impulsive behavior. Instead, a combination of symptoms from both of the categories are exhibited. Most people with or without ADHD experience some degree of inattention or impulsive behavior, but it's more severe in people with ADHD. The behavior occurs more often and interferes with how you function at home, school, or work, and in social situations. Most children have combination type ADHD. According to the National Institute of Mental Health, this type is more common in boys compared to girls. The most common symptom in preschool-aged children is hyperactivity. Symptoms can change over time, so the type of ADHD you have may change too. ADHD can be a lifelong challenge, but medication and other treatments can help improve your quality of life. The exact cause of ADHD is unknown, although some have speculated that ADHD develops in response to factors like eating too much sugar or living in a chaotic environment. Research has not found evidence to support these claims. Rather, it's thought that genetics play a role in the development of ADHD. Other factors that researchers are looking into include brain injury, exposure to toxins like lead, either in pregnancy or from a young age, alcohol or tobacco use during pregnancy, premature birth or low birth weight. ADHD can affect anyone, but it's twice as common in males. Symptoms of ADHD typically start to crop up at a young age, between ages 3 and 6, with the average age of diagnosis being 7 years old. An initial diagnosis may reveal one type of ADHD, but symptoms can change over time. This is important information for adults who may need to be re-evaluated. After you've been diagnosed, there are a number of treatment options available. The primary goal of treatment is to manage ADHD symptoms and to promote positive behaviors. Your doctor may recommend behavioral therapy before starting any medications. Therapy can help people with ADHD place inappropriate behaviors with new behaviors or help them find ways to express feelings. Parents can also receive behavior management training. This can help them manage their child's behavior. It can also help them learn new skills for coping with the disorder. Children ages 6 and up may benefit most from a combination of behavior therapy and medications. Medications are available to help reduce hyperactivity and impulsivity and improve the ability to focus, work, and learn, as well as physical coordination. There are two types of ADHD medications: stimulants and non-stimulants. Stimulants are the most commonly prescribed ADHD medications. They work fast by increasing the production of chemicals in the brain that help with thinking and attention. Between 70 to 80% of children have fewer symptoms while taking these medications. Those stimulants do come with side effects such as anxiety or irritability, decreased appetite, headaches, increased blood pressure, sleep issues, stomach aches, tics. Some non-stimulant medications are also available for treating ADHD. These can also be used to help improve focus, attention, and impulsivity, but they don't work as quickly as stimulants. Non-stimulants are a good option for those who are not seeing improvements or are experiencing negative side effects with stimulants. Adults with ADHD often benefit from the same treatments as older children. It's important to work closely with your doctor to determine the best treatment or combination of treatments and the right dosage to help your ADHD. Most children diagnosed with the disorder no longer have significant symptoms by the time they are in their mid-20s. But ADHD is a lifelong condition for many. You may be able to manage ADHD with therapeutic options, medication, or both. If you enjoyed this video, subscribe, share, like, and comment.